New tonight, medical debt is a crisis hiding in plain sight. And for the 800,000 Ohioans living with unpaid medical debt, it is a burden they simply can't escape.
So tonight we take you inside the realities facing ordinary people for whom rising hospital bills, lawsuits, wage garnishments, and credit hits have become part of everyday life.
10 TV's Kevin Landers explains how 2 Ohio lawmakers are working to protect those drowning in debt.
I went to the hospital back in 2018.
Maddie Randolph joined a growing number of Americans battling medical debt.
They're suing me for $4,111.
Randolph was treated at Mary Rutan Hospital in Bellefontaine, but says she wasn't billed until years later.
I just got my first bill maybe 2 months ago.
The hospital says it can't speak on individual cases and added, legal action for payment on medical bills is always the last resort, only after we have worked with patients to offer every available alternative. From 2021 through October of this year, the nonprofit hospital says it provided $3.4 million in charity care for those who could not afford medical care. Randolph says the hospital has threatened to garnish her wages for non-payment.
Of course it's stress, because if they're going to garnish like 25% of my wages, in this economy nobody can live off of that.
The hospital says it ended reporting medical debt to credit bureaus last year. It declined our request for an interview, so it sent us this video response instead.
The sustainability of our organization does require that we seek collection of patient balances, but the use of legal process is extremely rare, and in fact only 1.5% of all of our open patient balances over the last 5 years have gone to the legal process.
Like most rural hospitals, keeping the doors open is getting more difficult as patients with no insurance or not enough insurance make it harder for hospitals to pay its bills. Over the past 5 years, the hospital says it filed legal action against more than 3,000 patients, or about 1.5% of its patients' accounts with a balance. The hospital points to several reasons for increased court filings: a backlog of accounts from COVID-19, changes to Ohio law that shorten the time to collect from 8 years to 6 years, and liability laws require hospitals to take legal action against the recipient of medical care first, then the spouse, resulting in multiple filings. 2 Ohio lawmakers, a Democrat and Republican, are uniting to help ease the burden for Ohioans who are drowning in medical debt.
Medical debt is the #1 reason why people go into bankruptcy in this country.
Democrat Michelle Grimm and Republican Gene Schmidt are co-sponsors of the Ohio Medical Debt Fairness Act. It would do 3 things: prohibit medical debts from going on credit reports, ban wage garnishment, and cap interest at 3%. It currently stands at 8%.
All we're saying is you still owe them money, but we're not going to push you to the brink of bankruptcy in order to pay it.
The Trump administration says shielding consumers from having their medical debt appear on the credit report is something only the federal government can do, not states. That could impact Ohio's bill, which has opposition.
The only people that came out against the bill were the debt collectors. And when I had them in my office, they said, "You don't understand. We might be out of a job."
Dr. Vikas Sani is president of the Loan Institute. It's a nonpartisan think tank advancing a more affordable, effective, and fair healthcare system.
I don't think hospitals should be expected to solve the problem of the affordability of American healthcare all by themselves. I mean, we have a big problem in this country. The prices are too high. A lot of what gets done is probably not that necessary.
As for Maddie Randolph, she's headed to court and hopes she can keep the bill collector away.
What's going to happen, do you think, if you can't make these payments?
I don't know. I feel like in this circumstance, maybe bankruptcy.
She's hoping state lawmakers can throw her a lifeline.
Everyone should be able to have affordable health care. Everyone should be able to afford basic needs, and if they're sick, be able to go to the hospital.
Kevin Landers, 10 TV News.